thank you very much for having me join this call. I think it's really important, and I appreciate the opportunity to talk a little bit more in a little bit more detail about what the competitive bidding program is. As you can see up on the screen, there's a presentation. It's just an 8-slide presentation, just giving you some of the main facts about the program and which areas it's affecting and what product categories it's affecting. But I did want to just give you a brief overview of the program, and then we can get into more specifics about how it really is impacting consumers and how consumers can do something about trying to stop this program from being fully implemented. The initial implementation of CB, competitive bidding, was in 2008, and it was only in effect for a couple of weeks because we worked very closely with consumer groups like yours and other consumer groups nationally and regionally, as well as other provider groups to stop the program, because we really felt that it was only looking at a price service component. The problem with the program, they did delay it for a little bit, but then they went straight into re-implementing it again, and that's why we have it again, the rebid, as they call it, round 1 rebid, which started in January of this year. In 9 areas, including Pittsburgh and San Bernardino, Riverside area, and other cities. And round 2 will begin in the summer of 2013, where it will impact 91 additional areas, including places like San Jose, Oxnard, Ventura area, Bakersfield, Santa Ana, Long Beach, Sacramento, San Francisco, a whole host of different areas. And the big concern for us as to how this program is set up is that bidders, the provider companies that provide medical equipment that's needed in the home for folks that need it, people with disabilities and the elderly, they only allow to bid a certain price, and then CMS kind of decides, they take the middle price, and everyone else is discarded from the pool, and then those companies have to provide a product at a certain price. Unfortunately, that doesn't account for all the service, the repairs and all the other issues that are needed to look after consumers that rely on their providers. Some of the examples that we've seen just since January with the problems of the program is, for example, a wheelchair user in the Miami CBA who was used to using one specific provider. Now that it's in a CBA, is limited to which provider she can use, and the closest wheelchair provider for her is 60 miles away. Unfortunately, it's difficult for her to get around to get her wheelchair repaired, so that does cause a problem when it comes to service, because all the other providers that are in her area that she used to use are not allowed to service her because they didn't win the bid. I put "win" in quotes. So that's really a really big overview of what competitive bidding is. I'm happy to talk a little bit about what's happening with the debt bill, the Budget Control Act that was passed, and we can go into a little bit more detail about how consumers are really being impacted. But that's really an overview of the program. As far as the recent Budget Control Act, that's what it's called, the name of the bill that was passed earlier this week, they are going to, the joint committee that this legislation is going to put in place, they're going to finalize all the members of the joint committee August 16th, and they're going to look at recommendations of deficit cutting. If they can't come up with $1.5 trillion in cuts, it's going to be forced. They're going to be forced to look at Medicare cuts. So it is critical that we keep up the pressure and keep, make sure your members of Congress know about what your services are, what products you rely on in your communities, and how you're concerned about this program, because they will be looking at things to cut throughout the fall, and they'll be those recommendations will be finalized in December for them to be implemented. The legislation that we've been pushing very hard for, and I know that's the name of the website that you all dialed into, 1041, that's the bill that gets rid of this program entirely. And Congressman Thompson in Pennsylvania and Congressman Altmaier, who's a Democrat in Pennsylvania, Thompson is a Republican, introduced that bill earlier this year in March, and we now have, it's updated since that slide, but we now have 145 co-sponsors on that bill. And as you can see from that slide, there are several consumer groups that are also supportive of 1041. And the full list, there are at least 30 or so that have signed on to it. And there's a letter that consumers signed on to as well to Congressman Thompson and Altmaier in support of getting rid of this program, and some of the names you see there. Also, economists, 244 leading economists from across the country and from other countries as well, agree with us that the program is bad. It doesn't work. It doesn't work for appropriate health care for patients, and it doesn't work for providers to be able to stay in business to provide care to patients. Right now, there is an update with representatives from California. Now we have Susan Davis as well on board, but that's still only 2 out of 53 from the whole California delegation. So, we can go in a little bit more about what kinds of things you can do there, and we have various pages on our website at ahomecare.org where you can download more information about 1041. Our www.ahomecare.org/at-home is a page totally dedicated to consumers with resources for consumers and information about competitive bidding, and templates for you to send to your congressman in California that represent California to talk about the reasons why you want the program to be repealed or terminated. So that's really, I hope I didn't throw too much information out there, but Alan, would you mind scrolling down this web page to the bottom? Or are folks that are on line be able to do that? Okay, thank you. Thank you. So as you can see, the Get Involved title there, you can send an email or a letter to legislators, and the sample 1041 letter and a sample Save Home Care letter are right there for you to download. You can also, if you go to our main homepage, click on the ahomecare.org, and you'll see we have links to Twitter and to Facebook, and you're welcome to follow us on those sites. You could scroll down a little bit. You'll see on the right we have a Twitter and a Twitter and a Facebook link there. And then we've been collecting hundreds of problems from consumers, from physicians, from discharge planners, from providers, of course, about the problems they're seeing, and they all we're seeing a lot of the same issues throughout. The problems with delays of patients being able to leave the hospital because it's difficult for discharge planners to match consumers with the right products because there are fewer providers out there now that they're allowed to use if you're in a competitive bidding area. Difficulty in finding products and services that are needed, and fewer choices for consumers. And unfortunately reduced quality, because if providers are forced to just to stick to a certain price, it's very difficult for companies to continue to provide the full range of services that's required for patients. We really, so really that's kind of an overview of all of the issues that we've been dealing with, and you saw that button before Alan closed that window, the competitive bidding problems. That's where we've been collecting hundreds of problems from all the different stakeholders. Let me see quickly if there are any other points that I want to highlight. Let me go through this presentation with the other slides, but it just continues to go, affecting patients that is out of business. And then the final page is, again, the reaching out to your congressman or congresswoman about 1041, and really that's really how you could help us. We'd like to, we actually met with Congressman Thompson and Congressman Altmaier earlier yesterday, I apologize, and they're fully behind our initiative to get rid of this program. We've been also reaching out to the Senate side as well, and Senate is always a little bit behind the House, where the House is, but we've been educating a lot of senators on the issue as well. So we're pushing for a Senate bill as well to match the House bill. So I'll leave it at that, just so I'm not overwhelming you too much with this information, but happy to answer any questions that you have. Alan?
Okay, and I think it's a good time for perhaps Kelly to weigh in and talk a bit more about the impacts on consumers.
Okay, can you guys hear me?
Yeah.
I can hear you.
Okay. Great. Oh, well, my name's Kelly Turner, and I'm with People for Quality Care, and we're a grassroots organization dedicated to helping bring awareness of the competitive bidding issue to the American people. We work with Alex and her group, and together trying to capture every win we can across the nation, with the large national organizations and their groups down to small communities and people within that community that need to be aware of what's going on. So one of the questions was, how has competitive bidding impacted consumers? Well, again, just to highlight some of the things that Alex already has spoken about is loss of choice, because these people depended on their local provider who they've been doing business with for years may no longer be available to them because of the competitive bidding. Now they've lost their choice on who they can use to take care of them. And with that loss of choice, and maybe relying on a provider who may be located 100 miles away from them or even in another state, obviously the service component is definitely going to be hurt. They're not going to get service in a timely fashion. And the quality of service that they may be getting, they may not have any specialization to that need, because the home care providers that are winning these contracts are winning them based off the lowest bid. It has nothing to do with quality of service. It has nothing to do with where they're located at. It has nothing to do with their specialization, and it has nothing, most importantly, to do with your choice and if you feel comfortable doing business with them. So along with those losses, you now are going to have those patients, those consumers who are going to lose their independence, because when they have to wait longer to get their wheelchair or get their bed, now they're going to be confined to their bed or confined to their home because they don't have the equipment they need to go to work, to go to a grandchild's ball game or whatever. They're basically going to be stuck because they don't have that service available to them or that equipment available to them. Peace of mind for the patient and the caregivers. You know, most of these people have been using their home care providers for years. They feel very comfortable with them. They're on a first-name basis. They probably go to church with them because they're in the same community. They just feel very comfortable having them in their home and knowing that they're going to be able to take care of them. And you know, now if they have to wait for a provider that's not even located in their area, just that worrisome of knowing, is their loved one going to be taken care of? How much more burden is this going to be on me now that I don't know whether my loved one will get the equipment they need and the service that they need and the quality service they need? So a peace of mind is going to be lost there. Also the ability to age in place. If we can't have the amount of providers that we need to be able to get the equipment to these people that need it so they can have some independence, they're not going to be able to remain in their homes because they're going to need additional care that their loved one isn't going to be able to give them, and they're going to be required to probably go to an assisted living or a nursing facility. So when you ask people where they want to age, where they want to stay, I can guarantee you they're all going to say they want to be in their home. And then last thing on that is compliance is probably going to diminish due to the stress of getting help. You know, I've experienced some of these people trying to get assistance from Medicare and the contracted providers, and it just gets so frustrating and burdensome to them, they just give up. And once they give up, then they don't comply, and then it ends up, you know, being more harmful to them in the long run. So those are some of the impacted things that are happening to consumers based off the competitive bidding. And some of the things that you'll see increase is emergency room visits, longer hospital stays, or more returns to the hospital because they are not able to get the service they need in a timely fashion. Again, caregivers' time. They won't have the ability to get that assistance they need from the home care provider, again, who's in their community, who can provide service 24/7 whenever they need it. Now they're going to be required to find ways that they can get that needed help for their loved one, which could be a nursing facility. Taxpayer dollars, it's going to be more expensive for Medicare because people will be going to emergency rooms, staying in the hospital longer. It's more expensive to provide oxygen to a patient in the hospital versus being in their own home. And again, these people are sick, they're already possibly maybe confused and frustrated, and it's just making it more difficult on them if they can't get the equipment and service they need. I'd like to share some examples with you. What we've been doing is we've actually been traveling to some of these competitive bidding areas, and we've been speaking with some of the people who've been affected by the competitive bidding that's already implemented in their place where they live. I spoke to a registered nurse of a home health provider, and she shared a story with us where some of their patients are having increased injuries, longer hospital stays, all because it took too long to get the equipment they needed from the contracted provider. The agency went from having 10 to 15 providers in their area that they could always call on, they could choose from and call on and get the service that they needed, and now they're down to one provider who has to serve a larger area. And these providers may not deliver on the weekends, or may not, some of the experiences she's had is that she's tried call after call and just trying to get someone to respond. So again, that will keep their patient in the hospital longer. An example that she had given me is that one of her patients needed a bed, needed a low bed. She had the prescription from it, but she was having a hard time getting someone to respond to her specific need. And in the interim, the patient that required this bed fell and broke her hip. So now it's a safety issue. So again, these are things that we really need to be concerned about because, again, that patient broke her hip and ended up going back to the hospital. So just the comment of the RN, call after call after call to find a provider for equipment delays care. And especially in rural areas and smaller suburban areas, they really suffer. I met with a muscular dystrophy patient who needed a hospital bed. He had a script and approval from Medicare, but there wasn't a provider in his area. And this gentleman resorted to purchasing his bed on a used bed on Craigslist. Now he got the bed, but the service component for if anything happens to that bed is not there. And they deserve better than this. And my last example, and I have many of them, you guys, but my last example is there was an MS patient who was confined to beds and her home for 4 weeks because she couldn't find anyone to service a battery, get a new battery for her. She had called providers listed on a book provided by Medicare and still could not get the help she needed. So the competitive bidding is really negatively impacting the consumers and making it very difficult for them to get the care that they need. So it's very important that we do, bring awareness to our legislators regarding this issue. If you were to ask me, what can you do to help fight competitive bidding? I would say the things that you can do are educate yourself and others about competitive bidding and what it means to you as a caregiver, what it means to your loved ones who may use home medical equipment, what it would mean to you as you age and want to stay at home, and if you needed additional equipment to help you stay independent, what that would mean to you. You can contact your congressperson, and as Alex said on their website, they have the ability for you to take action there as we also do on our website. And then advocate. Tell your story. Tell about the importance of having quality medical equipment and service when you need it. Your voice does matter and you can make a difference. And those policymakers want to hear from you. They want to hear why it's important for you to have that. And so you guys will really, really make a difference. People for Quality Care also does have a website and a Facebook page. We have an action center on both sites. We allow you to tell your story. So if you're not one that likes to be interviewed and you like to write, you can go directly to our website and input your stories. We have how to understand the issues. Basically, we're trying to make it as simple as possible for the average American to come to this site and be able to understand what we are talking about and hopefully raise awareness and compel them to advocate on their behalf. So on our website, it's all patient-centric, and again, hopefully easy information to understand, easy opportunities for you to participate in advocating for quality equipment, good service, and a choice. And so please collect your stories. Please speak out. Please visit our websites. Feel free to call us and ask us if you have any questions. You can do face-to-face visits with your congressman at any fundraising activities that you may be at. They work for you. Don't hesitate to speak and let them know what you need and what you deserve. And we also provide resources. We have brochures and frequently asked questions that are available for you. You can just contact us at our 800 number or on our website. You can find them under research, studies, and articles, and there's printed material available there. But these are also nice pieces of information that are simple to understand, that get to the point, that explain what competitive bidding is and what you can do to help fight it.
Thank you. And I just want to open it up now to any questions. And I'm particularly curious, I see we have one person from the Community Access Center in Riverside. Wondering if you've had any consumers that have brought this to your attention. And it looks like Tino does have a question. how much money is the government projected to save through the competitive bidding process, I assume?
Hi, is my mic on?
Yeah.
Yes, we can hear you, Alex.
Okay. Yeah, I can answer that question. It's a tricky question when you say how much money competitive bidding is going to save, because it really isn't going to save any money. That's what CMS says, but as Kelly was explaining, when there are more and more users that end up in the hospital because they don't have access to the right products and services, they'll end up in the hospital, and that actually shifts costs to Medicare Part A from Medicare Part B. And I just pulled out the chart, actually, a cost comparison chart, where it shows that 1 day at home with oxygen is less than $8. And if you spend a couple days in the hospital, it's $1,600. Mm-hmm. So, you know, the statement that CMS thinks that they're saving money with this program is not true. I mean, we have in the legislation itself, we have monies to pay for getting rid of the program, and that's $20 billion, and that was what they call is scored. They cost out the program, and that was officially approved by the budget office in Congress, Congressional Budget Office. But to answer your question, they're not saving money. They're going to make costs increase. And just to explain, I missed telling you who A Home Care is in my excitement to get into the issue of the webinar. A Home Care, to those of you that don't know, it's the American Association for Home Care. We represent medical equipment providers and manufacturers of all types of equipment, from diabetes supplies to wheelchairs to oxygen to hospital beds, all of anything that you can think of that's used in the home. And we are, you know, in 3,000 locations throughout the United States. And one of my jobs here at A Home Care is to work very closely with consumers like you and like others. So I just wanted to give you a quick description of that.
This is Julie West, and I don't have access to the regular webinar. Can everyone hear me?
Mm-hmm.
Okay. Your organization represents DME Dealers, is that correct?
Who's talking?
This is Julie West. I'm the assistant technologist, one of two at the Westside Center for Independent Living.
Hi there. How are you?
Hi. Is it correct that your constituency, other than the public, are those that supply durable medical equipment? Is that correct?
Yes, that's what I mentioned. We are the association that represents medical equipment providers and manufacturers. So providers they're not just folks that drop off equipment. That's not the right way to describe it.
No, I'm an AT, and I've been doing this for 10 years, so I completely get it. I'm about to play devil's advocate, and I actually support the being against competitive bidding. But I will say right now, there are formularies on Medicare and Medi-Cal and any type of private insurance that we all work within. And in order to get something that is non-formulary, unless you're going out of pocket, it takes an extensive amount of paperwork. And I think that what the government is trying to do is have a set amount that the DMEs can charge for standardized equipment. If something is, quote, medically necessary, unquote, then you go outside that formulary, and that ceiling is blown off. Now, what I want to know, and this is my understanding, it's not that they're saying that other DMEs cannot operate. It's that if they will not stick to that ceiling on the standard base model formulary items at the prices that the government has set, then they cannot operate with the government. But it's not saying that there can't be additional DME suppliers.
That's correct. Let me explain that. That is correct. There are other suppliers that, if you don't win the contract in the competitive bidding area, you're welcome to work with users outside of that bidding area. But here's, you know, it's unfortunate for the smaller companies out there that are providing service and product, because those smaller companies don't have the options to be able to reach out to other cities or other states. And so it does minimize the pool that patients have to reach out to, simply because CMS is only looking at a price amount for a product. They're not looking at all of the other things that are needed, with service.
But when we're talking about, you talked about an MS patient who needed a battery. You talked about a woman who needed.
No, that was Kelly. That was Kelly that mentioned.
Okay. But in that scenario, where the bed needed to be lower than standard height, that's considered a non-formulary piece of DME. Probably not something that a typical Medicare provider would carry. So in that scenario, either the Medicare provider would have to go outside their formulary if it was a medical necessity, or they would have to, Medicare would have to contract with a somebody who's not within their group. Is a matter of continuum of care. So basically, this is very bad business-wise for the DME. I will agree that it's very bad for the consumer because they don't have more choices. And assistive technologists in the IL system believe in choices and options, and I believe in having as many choices and options as possible. But I believe that anyone who has a license to process Medicare, if they are going to stick to the set price that the government has set on standard formulary items, can continue to operate. Is it true that they're only going to allow a few DMEs to operate, period, and form a monopoly? Am I misunderstanding this?
Let me try to explain it. With the bidding program, yes, it will. Only those people that, it's not even, providers submit bids to be able to furnish Medicare users, and CMS decides who wins the contract. It's not going to be everyone that submits bids. Okay, so say out of the 100 that submit a bid for one area, they'll only accept 50. Well, let's make it small. Let's make it 20 submit bids and only 10 get contracts. Those 10, and this is the CMS problem with the program, not all 10 have to even accept that bid, because there are no rules to say you're bound to accept the bid. So maybe only 5 of them will say, okay, we'll do business with CMS Medicare beneficiaries. So now you're down from 20 to only 5. And this is only in 9 areas. Let's say the same thing or a similar thing happens in other areas in the country, where in other product categories, and it is happening in other product categories where a certain number submit bids, and then CMS says, well, we'll accept half of that, and then even less than that we'll actually say, okay, we'll accept this contract. When you have that multiplied by 91 sites in round 2, the summer of 2013, and then beyond that, in 2016, the Secretary of Health and Human Services, Secretary Sebelius, has the ability, has the authority to apply bid rates, so the low rates that CMS thinks is appropriate, which we don't, obviously, to nationwide. So you're thinking of, okay, larger companies, yeah, they can just go to other areas, not a problem. But no, when it's nationwide, there is no latitude for providers or patients. Everyone is going to be affected, unfortunately. When you're talking about formulary issues, CMS did release each product in each product category that has to be accepted at, they call a single payment amount. So all those prices are already set, and I can go into more detail offline with you about that. But yeah, some of the larger companies right now may be okay and may be able to balance some CBA areas with non-CBA areas, but when it comes to the smaller companies, the local providers, many of the local providers and the small companies that consumers rely on have been cut out of the system.
the biggest issue here is monopolization, and there will not be enough providers to serve the patients in a timely fashion. But it won't be that they cannot get that which is medically necessary. I spend most of my time fighting for the needs of the patient. I wanted to summarize really with the bullet points what the big things are. It may slow down the patients getting what they need in a timely fashion, but I don't want anything represented in terms of a scaremonger, because the fact of the matter is, if something is medically necessary, even if it's outside that formulary or outside someone who is contracted with the government, they will be able to get what they need.
But you're right, Julie. They may get what they need, but as Kelly was saying, it's going to take longer, and that sometimes leads to, and we have examples of this. I'm not, this is documented in the information that we have that I've been receiving, where patients are having to stay in the hospital longer, and what Kelly said too, because they cannot be matched appropriately to the equipment right away. And physicians are telling us the same thing. They're finding it more difficult to get the right products and the right services. So,
just so you know, that is not going to happen in our area. What is going to happen is that they are going to have what's called an irresponsible discharge. Patients will be put at risk because they will be discharged by the hospital without the things that they need, placing them at risk of bodily injury. That should be your argument. And actually we see that all the time because the hospitals are losing tremendous amounts of money because they can't get reimbursed at the rates that they need to from Medicare. And I'm correcting. I do this all the time. All the time.
Yeah.
So really, that's probably, and I'm on your side, the biggest argument here is that patients are going to be placed at grave risk because they will be released without the things that are medically necessary, because their needs cannot be handled in a timely fashion, because there are not enough suppliers to handle the volume of need.
That's correct. You're correct, Julie.
What's your?
I just wanted to, because
I thank you for that.
Understand all the issues, but I did want to clarify it so I understood. Because our consumers will come in here and they want to know, and I needed to be able to have the working pieces to be able to address this issue.
Yeah. No, thank you for that. I appreciate that. I'd love to follow up with you offline. I'm happy to. Maybe I can get your contact information through Alan, and we can. Okay, great. Thank you.
Sure.
The projected savings, not the actual savings. Well, I think that's what I answered. I answered the fact that CMS is saying it saves $20 billion to get rid of it, but we're not sure how they came up with that number. It's mysterious calculations from CMS's side.
No.
So it's kind of a mess. So it's not really an easy question, unfortunately, to answer. But that's the number they're saying. Split between beneficiary co-pays is what they're saying. Some of the savings will go to. So that's how they come up with it. But again, we've asked for specific information about that, and they haven't been forthcoming. So it's a little bit of a mystery.
Are there any other comments or questions?
I don't know what this is Julie West again. I don't know what the argument is in terms of fighting this thing, but under the Patient Bill of Rights, one has to provide continuum of care, and you have to provide quality care, you have to provide that which is medically necessary, and you have to do it in a timely fashion. And that's the way I would go about it. I mean, you're not allowed to kill somebody or place them at grave bodily risk purposefully if they do not have enough suppliers to handle the need. Then certainly they're not going to be able to provide the continuum of care needed once one is released from the hospital. It's going to end up costing hospitals a lot more. They're not going to be able to do it in a timely fashion. And it's going to take more time to take care of processing paperwork. It's not going to save them from having to provide those things that are more expensive. It is, however, going to end up costing them money, as you had said, which was a very good point, because these people will end up going back into the hospital. But I assure you, they will be released. They don't want to. The hospitals don't want them in the interim, and that's really, those are the key bullet points to fight this.
And Julie, I know that the home care health agency and the nurse that I spoke to, this is Kelly, they don't want to let them out of the hospital if they don't have the appropriate equipment either for the patient's safety. So then the patient ends up staying longer in the hospital if they're allowed to do so. But you're right about everything.
Here. There's a few of them, yes, a few of them, no. For those that do not contract with Medicare, Cedars-Sinai, for example, does not contract with Medicare, all hospitals cannot release a patient if they're not, quote, stable, unquote. And it is against the law to make an irresponsible discharge. However, there are other hospitals that contract with Medicare, for example, UCLA, who will take more county hospitals who will play with that a lot more. They have to have the beds. And by the way, my degrees are at UCLA, so I'm not putting down UCLA, but I am saying that those hospitals, they're sort of playing with, are they going to have it cost them more not to get reimbursed, or are they going to have it, cost them the idea of violating the law in terms of continuum of care? Sometimes those hospitals choose to make an irresponsible discharge.
Can you hear me, guys? Hi. I wanted to add another point too about the quality of care issue, because on top of the delays and difficulties getting the right equipment and services, it's the quality of the products available, or the amount of products available, because you'll have a restricted choice of providers, but unfortunately, because CMS cuts the price at such a low rate, as they call a single payment amount, that you have to provide products at that amount. Many of the products that have maybe more of the bells and whistles or preferred features that users like, providers will not be able to provide those simply because they can't stay in business. So not only is it a delay issue and a quality of care issue, but it's also a choice of products, of restricted products that providers will be able to have on in stock for their customers.
For these providers, it's already the bottom of the barrel. It's already the base models. We have something called Continental out here, for example, which is one of these big companies you're talking about. But when it's medically necessary, they will be able to get things that are non-formulary. But it is true that we're about choices and options in an ILC. And I'm all about, they call me the Gadget and Gizmo Girl, new and innovative products. So that there are more products out there available to the consumer public, and if there is less of a motivation for profit, we're supposed to be in a democracy, obviously, and if businesses can't make money, then yes, that's why you'll see less providers. So I would go with, as opposed to the business end of it, we are about choices and options, and it will limit the choices and options.
I mean, that's, of course, and that's the consumer right to do that. I just wanted to explain a little bit more. Obviously, we represent providers, but we work closely, obviously, with consumers as well. So I was just trying to give you an overview.
To your benefit, don't work with the consumers on this one, because I know that I want to have all the choices and options available to me.
Absolutely.
Vaughn has typed a question in the chat area about other states that are involved with competitive bidding. Are cities and counties having the same outcomes?
I can answer that. I'm sure Kelly can as well. The feedback form that you saw, that button on our homepage, aahomecare.org, we've been getting feedback forms from all 9 competitive bidding areas in all the types of situations, examples that Julie and Kelly have mentioned. So yes, we are seeing that across the board. Kelly, did you want to add anything?
Yeah, I think as more and more people are becoming aware of the issue and doing their part and what they can do to bring this issue up to the policymakers within their cities and counties to hopefully work it up the chain of command to people in Washington.
And once again, when is the rollout expected to expand here in California? You mentioned the number of communities. I just was curious again about when that's scheduled to happen.
Yeah. Right. Round 2 with the additional 91 areas, and you can look at the PowerPoint slide. It has all of the cities. There are actually a couple, I think, that there's also Stockton, California that will be included. But you see Oxnard there. Oxnard is the Thousand Oaks, Ventura area, as well as all the other cities, and just add Stockton to that. But round 2 will begin in the summer of 2013. And what we'll be expecting any day now, or at least this month, we're hoping to hear from which product categories will actually be included in round 2. We were promised to get that from CMS this summer, so to help prepare for the upcoming round 2. So I'll be happy to share that list with you as soon as we get it, so you can be prepared as well. Before we wrap up, that I wanted to highlight is, of course, the importance of reaching out to your members of Congress. Mm-hmm. They want to hear from you about these problems that are happening. So that's my final request. And please, I'm happy to answer any other questions. I can give you my email address right here. It's ALEX is in boy at aahomecare.org. Thank you. Thank you.
And I'll remind you that we have an action alert on the CFILC.org website. Is one way that you can contact Congress, as well as directly, and either American Home Health Care or People for Quality Care are also collecting stories from consumers. So you run across people that are having problems, I urge you to share those stories and help get the word out about this. Again, thanks to Alexandra and Kelly for
welcome
your presentations and helping us today and educating us about this issue.
Thank you very much.